Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, registered dietitians and nutritionist, Lauren Papanos and Romana Brennan.
Hello, everyone, and welcome to Nourish MDs. I'm one of your hosts, Lauren Papanos, also joined today by Romana Brennan. And we are going to be talking with Dr. Aziz. She is a podiatrist. Dr. Aziz, welcome to the show, and thank you so much for being here.
We had touched on plantar fasciitis. It sounds like that's one of the main reasons why individuals come to your clinic, being in the active area, seeing this very active community. Can you tell us more about what that is and how that manifests, if there's a spectrum of presentation with that?
Absolutely. So plantar fasciitis usually shows up in its typical form that most everybody is able. I joke again, as I said, when they go to Dr. Google and they look up heel pain. The typical presentation is patient is having heel pain closer to the midline of the body, basically. And they usually present with worse pain after periods of rest or when they first wake up in the morning. That's their typical presentation. And by the time they usually get to us, usually they've tried a few things and, that they've found online. But the main thing with plantar fasciitis is that the presentation can really vary. The most common one I just touched base on. However, a lot of times patients will come in, believe it or not, with outside of the foot pain. They're coming in with what they say is ankle pain or overall kind of like one side of my body has been sore. I don't know what's going on, Dr. Aziz. It's stemming from my foot all the way up to my low back. And when we assess them, we realize is that the plantar fascia, which is a non-stretchable band of tissue that attaches to the bottom of the heel and goes basically along the sole of the foot all the way to the toes. This band of tissue is non-stretchable. So when the foot basically is collapsing or the arch is basically falling, which is unfortunately something that happens to most of us as we go through the wonderful aging process, some more than others, depending on the structural integrity of the foot, which is based on our genetics. But as we go through life and this arch slowly, falls a little bit, there is tension on the band of tissue, the plantar fascia. And since it does not stretch, it's made out of fiber, so it does not have any stretchability, you get microscopic tearing. And that microscopic tearing creates inflammation. Inflammation then is, of course, felt as far as patients are concerned, and as far as pain is in the form of pain. So when the patient feels pain on the inside of their heel, their tendency is initially our knee-jerk response is, you know what, just shift the weight a little bit. So what do? We shift the weight on the outside. Well, we are not made to walk on the outside of our foot because those tendons are not made to withstand that much weight. As a result, most patients come in with tendinitis and or lateral ankle, which is outside of the ankle, pain. So you have to have a thorough exam and a high index of suspicion as to why did this patient suddenly have pain without any injury? And again, when you assess the patient thoroughly by having them walk and seeing what they're doing and examining the foot, you realize that the source of the problem is actually that plantar fascial band that is inflamed due to the microscopic tearing as a result of the arch flattening, which is the root cause of it. And when you assess that and when you address that, and we can talk about treatment if you want now, but when I, go through the explanation of what is the cause of the problem, then the treatment makes a lot of sense. So I touched on, it is simply put, the arch has collapsed due to the structural integrity or lack thereof, basically, as a result of your genetic makeup, then addressing that becomes key. You can do, all sorts of medicine, but unless you address the root cause of what led to that tight band of tissue tearing, you're not really, you're not going to have long-term success for your patients. So what we do in our office is, again, once we've established that plantar fasciitis is the diagnosis by the utilization of x-rays, of course, a very thorough clinical exam, then we can explain to our patients what the biomechanical cause of, meaning the flattening of the arch, which has a whole list of what I call pretty intense biomechanical, structural component to it. Once we try to explain that to the patient and they understand it, then the treatment will consist conservatively, usually, of controlling the root cause, which is the flattening of the foot. And that is done via a custom corrective orthotic, as well as other things such as physical therapy to deal with the secondary problems that we have created as a result of compensation, and sometimes some anti-inflammatories. And once we address the problem with those aspects of it being resolved, and the patient's heel pain, possible knee and or low back pain is then resolved. So that's kind of the little insight or quick look into plantar fasciitis. Now, most of our patients respond beautifully to what I just outlined as the most common treatment protocol for plantar fasciitis, which is the custom corrective orthotics, physical therapy, sometimes anti-inflammatories. But some, just like with anything else, don't respond. And today we are very fortunate because in the past, we really didn't have another alternative as far as treating this. So our next step would have usually been surgical intervention. But nowadays, with the advent of regenerative medicine, we can offer our patients a multitude of other treatment protocols, such as, stem cell injections and or PRP injections, which fall under the regenerative medicine treatments, which have been extremely successful in treating these, resolving the tough cases, and really not requiring us to resort to surgery, which is, I think, something that, again, the active community and even the non-active community, anyone really, doesn't want to have the added risk of surgical complications, anesthesia, et cetera, if we can get them better with conservative means.
Hi, my name is Lauren Papanos. I'm one of the registered dietitians here at PPMA. And as a PPMA patient, you might have heard us rave about the benefits of using FullScript before. FullScript is our online supplement dispensary. That means that you can access our library of hundreds and thousands of different professional grade supplements that can be delivered to your doorstep. Every supplement at the clinical and therapeutic dosages of what's been shown in research to support various different health benefits, as well as the highest quality. All of the supplements that are provided through FullScript have been third-party tested for accuracy within the label, and they also use quality assurance to ensure that it is stored at the proper temperature and delivered to your doorstep at the proper temperature as well, which is really important because a lot of companies aren't taking all of these measures. FullScript also provides us as your practitioner the ability to keep track of everything that you're currently taking, the amounts, the frequency, so that we have more context when you come in for a new appointment to understand any health modifications that we may recommend. Plus, the best benefit about FullScript is you get 15% off on every order. Plus, you get 2 to 4 day shipping. Now, if you have any questions, please never hesitate to reach out and ask us. Or if you're looking for a customized recommendation, you can schedule a nutrition consultation with our registered dietitian, Romana, who would be happy to review your testing results, gather more information about your nutrition and lifestyle to provide you a customized recommendation suited for your goals. And I'm glad you brought up the use of the stem cell therapy and the PRP, because I know that's something that you do in your practice. I think that's great that you guys are using these regenerative medicine approaches as another option before surgical intervention. So could you tell us a little bit more about how the stem cell therapy and PRP works, and maybe some of like outside of plantar fasciitis, are there any other common conditions or problems that you would use those types of treatment approaches for?
Oh, absolutely. It's been an amazing thing to be able to work with this regenerative medicine that is readily available to all of us. It used to be that just your elite athletes had this, but now we're very fortunate to be able to offer this to our patients. Essentially, the simplest way to look at what these regenerative medicines are, for example, the stem cell. Stem cell is basically an amniotic membrane and uh, umbilical cord tissue that is full of growth factors, things that we call cytokines that are there to reduce the inflammation and promote the optimal tissue healing in the most quickest way that the body can accomplish that. So that's the gist of what a stem cell injection will do. PRP, slightly different. Stem cell is something, of course, that we get from a lab and or a company, but PRP is something. It stands for platelet-rich plasma, but it's something that we're able to get from. We you come in, we draw your blood, we're able to spin the blood, and then what we do is with that spinning it in a centrifuge, it's able to separate the most golden part of the blood that also has all of those healing potentials, anti-inflammatories that allow a much more optimal healing potential, faster healing, and in essence, a targeted, basically, way of healing that part where we are injecting the either PRP and or stem cell. So by doing that, what you're doing is you're basically bypassing the body's slower, or sometimes inability to provide the injured part with all of those goodies that are responsible for healing things that otherwise wouldn't. From We use stem cell and I'll just and or PRP for a variety of things. In our office, we have noticed there's three doctors, and all three of us have noticed that we have reduced our surgical volume quite a bit by having this stem cell and PRP available for such things as partial tendon tears, chronic tendonitis, slow healing fractures. I mean, the list of things that I can go on and on about, can take forever. But essentially, if you think about it as if you have any injuries, be it soft tissue, tendon, ligament, bone, um, by us obviously identifying it properly by utilizing such modalities as MRI and CT, which we always do. Once we've identified the pathology, we often can offer patients these modalities, and essentially it's able to either altogether heal it in a much faster time frame, like I said earlier, or uh, absolutely negate the need for having to do surgery. So patients are able to get back to their activity level. There's less of a downtime, which means your loss of your muscle atrophy, other things that you would otherwise lose with a prolonged um, healing time. These regenerative medicines reduce the healing time. They increase the chances of you healing things conservatively. And so it allows the patient to get back to their active lifestyle much faster. And to date, I really haven't encountered any side effects. There's really, with the PRP, it's your own blood basically going into your own body. And with the stem cell, we did a thorough search right before I started talking to you guys just to make sure I didn't miss anything new. But there really isn't any, major stem cell side effects that are being reported other than the basic, well, the injection site was slightly sore or had a little rash and it resolved within 24 hours, but nothing that I would say that would be contraindicated for using these treatments. And as far as the types of patients that would benefit from this, there is no age limit. In other words, we can use it in young adults up to patients that have significant arthritis and they get relief even in their with their arthritis pain. So that spectrum is pretty wide.
Wow, that's fascinating. Thanks so much for sharing more about that information. And thank you so much for just being a wealth of knowledge. Thanks so much for your time today. I know I've learned so much about different issues that thankfully I personally don't have to struggle with, but I think young and old, we definitely, plantar fasciitis, athletes, things of that sort. There's no age limit to um, the extent to which individuals can be affected by foot and ankle issues. So thank you so much for being here today, Aziz. For anyone who's listening who's not familiar with you or your practice, are you able to just share with us how can someone find out more about you, about your practice, and how to schedule a consultation?
Absolutely. We have best way to reach us is, of course, through our website. It is Your Foot Doc, FOOTDOC.com, or any interested patients can look us up through ZocDoc.com. And if patients prefer to contact us via phone, our wonderful staff can accommodate patients usually within 24 hours, giving them an appointment 24 hours by contacting us at 949-220-0099. Again, 949-220-0099.
Wonderful. Thank you so much. And for anyone who's a PPMA patient already, you can feel free to give our office a call. We'd be more than happy to set you up for a referral to Dr. Aziz and her team. But Dr. Aziz, again, thanks so much for your time today. This was a wonderful conversation. Thanks so much.
Thank you guys for having me, and I appreciate all the wonderful conversation we had. If there's anything else I can do, please let me know.
Thank you.
Thank you.
Thank you for joining us for today's episode of Nourish MD, Doctor Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for